navigate the system. I'll do it.
Hundreds of doctors from New York gathered for an important meeting in Rome. This was not a typical medical congress. These providers care for patients with limited resources, many of whom are immigrants who feel lost in their new country. The meeting was organized by the group SOMOS. Many changes are made based on statistics alone, while the patient is forgotten. There are some things that must be done with the patient's well-being in mind. The patient's quality of life, his health, and his happiness must be taken into consideration.
The mission for this conference is we all get together, particularly for the primary care, to spread out, to give them their voice. And we see the policy here, maker here. We talk to those partners, the hospitals. We share our view and our experience with the patient. We want them to provide support to us to provide a better care for our patients.
SOMOS Community Care is a network of 2,500 providers that treats 1 million patients in New York's poorest neighborhoods. In a healthcare system where a financially limited patient receives low-quality care, it's common for the patient to receive rushed and superficial medical attention. The doctor may treat him out of obligation only, but dedicate very little time to him. New measures are being implemented to improve the quality of health care, like initiatives for healthy patients. Many of the doctors are immigrants who earned their degrees in their native countries. They later moved to the United States and obtained permission to practice there. The goal is to have medical providers who speak the same language as the patients.
Dr. TALLAI and his physicians are the doctors in the front line. They're the doctors that the patients see every day, deal with all of their life and personal issues as well as their health issues. And as a result, our relationship becomes interwoven, very tied together in the community.
It's crucial from the perspective of the patient to be treated and be guided through a complicated healthcare delivery system by people who understand them. And that's very, very important.
Their presence in Rome draws attention to the difficult situation of millions of immigrants. On top of the challenges that come from simply being a foreigner in a new land, they also face health problems. The conference in Rome included a meeting with the Pope. The attendees wanted to express their gratitude for the Pope's message, encouraging respect toward immigrants. They would like to show him that doctors know no bounds. In Rome, Melissa Butts, Currents News.